that moment,
Yeah.
you know it, don't you?
Yeah.
You're standing there, heart pounding, maybe clutching a tiny plastic stick, and it feels like, well, like your whole life is hanging in the balance, just waiting for a little line or maybe a plus sign or a clear word to pop up.
Oh, yeah. The anticipation.
It's supposed to be simple, right? Just pee on a stick, get a
Yeah.
clear answer. But gosh, as many of us have experienced or heard stories about, that moment can be anything but simple. Confusion, anxiety, massive excitement. It's all in there.
Absolutely. It's a real mix.
Today, we're embarking on a deep dive
Mm-hmm.
into the fascinating, sometimes, let's be honest, frustrating and surprisingly complex world of home pregnancy tests.
Mm-hmm.
We're going to pull back the curtain on how these seemingly straightforward little devices actually work, look at the common pitfalls that can lead to that unsettling confusion, and uncover some truly surprising, even rare scenarios that can really throw you for a loop.
Yeah, things you wouldn't expect.
Exactly. We're talking about things you might never have considered, like, get this, why carrying twins might actually give you a negative result. That's where it gets really interesting.
It does. It really does.
Our mission in this deep dive is clear. We want to cut through all the noise, give you the unvarnished facts from the latest research, and ultimately equip you with the knowledge to feel informed and hopefully confident.
Right.
Whether you're actively trying to conceive, maybe you're just curious about these vital little tools that can reveal so much, we want to ensure you don't feel overwhelmed. Instead, we want you to feel empowered by truly understanding what's happening. Okay, let's unpack this.
It's true. These tests are such a marvel of modern science, really, and yet interpreting the results can be so deeply personal and often, fraught with emotion.
Totally.
Understanding the core mechanics behind them is truly the first crucial step in demystifying the whole process, helping you feel a bit more in control of a situation that often feels entirely out of your hands.
So let's unpack this first bit then. We talk about pregnancy tests, but what exactly are these tests looking for when you use them? What's the secret ingredient, if you will, that your body produces that these sticks are trying to find?
Right. So the very core of every single home pregnancy test, doesn't matter if it's a simple paper strip you buy in bulk online or a fancy digital one that literally spells out the answer for you.
Yeah, the expensive ones.
Yeah. The core is its ability to detect a very specific hormone, and that hormone is human chorionic gonadotropin.
Okay, that's a mouthful.
It is, which is why we almost always just refer to it as HCG.
It's simple,
Yeah.
HCG, got it.
And this isn't just any old hormone floating around in your body. It's the unique chemical signal that your body specifically sends out when a pregnancy truly begins to establish itself.
Okay, so it's like a pregnancy announcement hormone.
Pretty much. And what's fascinating here is where this HCG comes from and when it starts appearing. It's produced by the very first cells that will eventually grow into the placenta. And this process actually starts incredibly early in pregnancy, like as soon as 6 days after conception. That's once the fertilized egg has successfully implanted itself into the nutrient-rich lining of your uterus.
Wow.
That implantation event is the critical trigger. It's when your body really starts signaling, okay, we're doing this, pregnancy is happening.
6 days after conception, that's genuinely quick. So the test isn't just reacting to any hormone, it's specifically looking for this HCG signal. Does the amount of this hormone matter, or is it just like its presence that triggers a positive?
Oh, it absolutely matters. The amount is key. And this is where the in-depth analysis really comes into play,
Right.
The reason HCG is so crucial and detectable by these tests isn't just that it appears, it's that its levels rise rapidly, like really fast.
Good.
In those very early weeks of pregnancy, HCG typically doubles every 2 to 3 days.
Every 2 to 3 days.
Yeah. This exponential increase is precisely what allows home pregnancy tests to pick up the pregnancy as it progresses. Think about it. A little bit of HCG at day 6, then maybe twice as much by day 8 or 9, and that rapid escalation just continues. This quick doubling makes it much easier for the tests to cross their detection threshold.
Okay, that makes sense. It's not just there, it's growing fast.
Exactly. So to give you an illustrative example, you can really think of HCG as a secret messenger. This messenger carries the news of pregnancy throughout your body, primarily via your bloodstream and then filtered into your urine.
Right.
The pregnancy test strip itself has these tiny detectors, these are special antibodies, that are specifically designed to react only to this HCG messenger.
Like little locks waiting for the HCG key.
Perfect analogy. And if enough of this HCG messenger is present in your urine, these detectors on the test strip undergo a distinct chemical reaction that changes color. This color change is what ultimately reveals your result. So whether it's two distinct lines, a clear plus sign, or for the digital tests, the unambiguous word pregnant. It's quite an ingenious little piece of chemistry packed into that simple plastic stick.
That's a fantastic analogy, the messenger and the detectors. It really helps visualize what's happening on that tiny strip, like a microscopic chemical handshake, sort of. And I can definitely see how that rapid doubling makes detection possible over just a few days. It's not static.
Exactly. And understanding this foundational science, how the hormone is produced, how quickly it increases, and how the test uses these specific detectors, well, that helps us see why timing and proper technique are so critical when taking these tests.
Right. It's not just magic.
Not at all. That understanding is key to getting the most accurate result, which leads us seamlessly into our next important point about achieving accuracy.
Okay, so if HCG levels are always rising, you might think, well, it doesn't really matter when I test as long as I eventually get enough hormone. But is that really the case? Does the precise timing of when you actually use the test make a big difference?
Absolutely. Huge difference. While it's true that HCG levels continuously rise, the timing of your test is paramount for accuracy, especially in those very early days.
Okay.
You'll see some pregnancy tests on the market, the ones labeled early result or early detection, claiming they're sensitive enough to detect pregnancy as early as 5 days before a missed period.
Yeah, I've seen those. Tempting.
Very tempting. But experts universally recommend a more conservative and, frankly, more reliable approach. They really suggest waiting until at least the day of your missed period.
The actual day you expect it.
Exactly. This just gives your body a much better chance to produce a detectable level of HCG that will register clearly on the test, reducing ambiguity.
Okay, so why is waiting better? What's the science there?
Well, the reason for this recommendation is rooted in the inherent biological variability of HCG levels in early pregnancy. Everyone's different. The FDA, for instance, highlights a really significant detail. Up to 20% of pregnant women won't actually get a positive result on the very first day of their missed period.
20%. That's quite a lot.
It is. And this isn't because they aren't pregnant. It's because their HCG levels, while definitely rising, might not yet be concentrated enough in their urine to cross the test's specific detection threshold. Every woman's hormone levels rise at slightly different rates. And crucially, implantation itself, when the egg attaches, can happen a few days earlier or later within that 6 to 12-day window after conception.
Right, it's not always textbook timing.
Not at all. This natural variation directly impacts when HCG becomes reliable detectable. So testing too early, even if the box says you can, just increases the chance of a false negative.
That's a crucial piece of information. So even if the test says it's early detection, waiting a little longer is a much safer, more reliable strategy for getting a clear, unambiguous answer and avoiding that unnecessary anxiety.
Precisely. To give you an illustrative example, imagine you're trying to spot a tiny specific fish in a vast lake. Early on, it's just a tiny trickle of water slowly entering that lake, carrying maybe one or two of those fish.
Hard to see.
Very hard. But if you wait a few days, that trickle has become a more steady flow, bringing more fish in, making it significantly easier for your detectors, your fishing net, to see or catch that specific fish.
Makes sense.
And if you have irregular periods, which, let's face it, many people do, and it can make it incredibly difficult to pinpoint your missed period day,
Yeah, that's tough.
then waiting even longer, maybe something like 36 days from the first day of your last period, or roughly 4 weeks from the date of unprotected sex, can provide a much more reliable benchmark for when to test. This patience often prevents a lot of unnecessary anxiety that can rise from getting a negative result too soon, only to find out you were, in fact, pregnant later on.
That makes perfect sense.
Apple girl.
It's all about giving your body enough time to, well, do its thing and produce those hormones to a level the test can actually see.
Exactly.
And it's not just when you test, right, but also how you prepare for the test itself that can make all the difference in getting an accurate reading.
Right. So I've always heard the advice, take a pregnancy test first thing in the morning. Use your first morning pee. Is that just an old wives' tale that's been passed down through generations, or is there a real solid scientific reason behind that recommendation?
It is absolutely a genuine best practice, especially if you are testing in very early pregnancy when those HCG levels might still be relatively low. There's a very solid scientific reason for it.
Okay, lay it on me. It's all about concentration. Your urine is most concentrated when you first wake up in the morning, particularly if you haven't had anything to drink throughout the night.
Right, you haven't diluted it yet.
Exactly. This means that any HCG present in your system will be at its highest concentration in that first morning urine. That makes it considerably easier for the test to pick up, especially if your overall HCG levels are still quite low and just barely crossing that detection threshold.
Okay, so higher concentration equals easier detection.
Precisely. Conversely, if you drink a lot of fluids, say you wake up and chug a big glass of water or have a couple of cups of coffee before taking the test, you can significantly dilute your urine.
Yeah?
This dilution can potentially lead to what's known as a false negative result. The HCG is simply too spread out, too diluted in your urine for the test to detect it, even if you are indeed pregnant.
So you could be pregnant, but the test says no just because you drank too much water.
It's possible, yes, especially very early on. So if for some reason you absolutely can't use first morning urine, then the next best thing is to try and ensure you haven't urinated for at least 3 to 4 hours before taking the test. And definitely avoid excessive fluid intake during that time to maintain some level of concentration.
Okay, hold it for a few hours, basically. That makes sense. It's not just about how much liquid is in the bladder, but the concentration of that liquid, like trying to find a scent in a really watered-down solution.
Think of it precisely like that. Or remember our fish analogy?
Yeah, the wake.
Okay, imagine trying to spot a tiny, very specific color of fish in a small pond this time. If the water in the pond is a bit murky and concentrated, maybe like your morning urine after several hours without fluids, that fish, even if it's small, is much easier to see because its color is more prominent against that background.
Right, it stands out more.
Stands out more. Now, if you've just added gallons and gallons of clear water to that pond, making it very diluted, well, it becomes exponentially harder to find that same tiny fish, even if it's still there, because its color is all washed out.
Oh, okay.
That's essentially what happens with HCG when your urine is too diluted.
That's a very clear analogy. It really drives home the point of concentration.
Yeah.
Okay, so beyond timing and hydration, the physical test itself needs to be handled correctly, right? And that starts with knowing its shelf life. So if you're like me, maybe you've got an old test tucked away in the back of the medicine cabinet. Could be from months ago, maybe even a year ago, left over from a previous cycle or just forgotten. Probably not a good idea to just pull that out and use it. Yeah. Right? Even if it looks fine.
Correct. That's a crucial point. And it's a surprisingly common oversight. People just grab the first one they see. Well, pregnancy tests do, in fact, expire. They typically have a shelf life of 1 to 3 years after their manufacture date, and using an expired test is a common cause of unreliable results. It's a mistake that can easily lead to unnecessary stress or confusion, often giving you a false negative when you might actually be pregnant.
Okay, so why do they expire? What actually goes bad? Is it the plastic?
It's not the plastic, no. The reason is purely scientific. It's about the chemistry inside. Remember those HCG detectors we talked about earlier? Those special antibodies on the test strip that react to the hormone?
Yeah, the little locks.
Exactly. Over time, just like any chemical reagent, they lose their potency. They degrade. Their effectiveness diminishes. An expired test is simply less sensitive. It means it might not detect HCG even if you are pregnant because the chemical reaction just can't occur reliably anymore. It's like a battery slowly losing its charge over time.
That's fascinating. I had never really considered that the actual chemicals on the test strip would degrade like that. It's not just about the packaging, but the actual science inside the stick itself.
Exactly. And this isn't just theoretical, you know. Dr. Layan Al-Romani, who's a well-respected obgyn and maternal fetal medicine specialist, actually shared her own anecdote about this very issue.
Oh, really?
Yeah, she once experienced a false negative result when she was pregnant with her second child. And after double-checking, it turned out the test she used was expired.
Wow, even a specialist.
It just goes to show how common and easy this mistake can be, even for someone with extensive medical knowledge. It's an easy detail to overlook in that moment of anxious anticipation. You just grab the test and go.
Totally understandable.
So for some practical advice here, if you're looking to save money, don't rely on an old expired test thinking it's fine. A new, cheaper generic test is always preferable.
Always buy new.
Always buy new. It's important to remember that all home pregnancy tests sold in the U.S. are FDA cleared for accuracy, regardless of their price point. You don't need to splurge on the most expensive digital test with all the bells and whistles to get a reliable result.
Right.
But you do need a fresh one, stored correctly according to the package, and well within its expiration window. Always check that little date on the box or the foil wrapper.
That's a great tip. Save money, but buy new. Got it. And once you've got a fresh, non-expired test, Following the manufacturer's instructions to the letter is paramount, you said. It sounds incredibly obvious, I know, but I bet people skip reading the instructions on these tests all the time. Is it really that big of a deal? Like, how different can one stick be from another? You just pee on it, right?
It is, perhaps surprisingly, one of the single biggest sources of user error, leading directly to inaccurate results. You'd be amazed. While the general concept of a pregnancy test seems straightforward, each brand can have slight but really significant variations.
Like what?
Well, how you collect the sample, for instance, how long you need to wait for the result, or even exactly how you read the result window. Overlooking these specific details for the brand you're using can lead to a lot of confusion and potentially wrong answers. For instance, some tests require you to urinate into a clean, dry cup first, and then use a small dropper to place a precise number of drops of urine into a testing well on the device.
Right, the little cassette ones.
Exactly. Others allow for direct urination onto the absorbent stick itself, usually for a specific number of seconds. But the most critical part, the one that's often overlooked or rushed in the moment, is the waiting time.
How long you have to wait before looking?
Yes. This period, usually specified as between 3 and 10 minutes depending on the brand, is absolutely essential for the chemical reaction to properly develop and for the results to stabilize. Reading the test too soon can easily lead to a false negative because the reaction simply hasn't had enough time to fully complete.
Okay, impatience is bad here.
Definitely. And just as importantly, reading it too late, like way after the specified window, maybe you set it down and forget about it for half an hour. It happens. Well, that can lead to something called an evaporation line. This is basically just where the urine has dried on the strip, and it can sometimes look like a very faint positive line, causing unnecessary worry or false hope.
Oh, that makes total sense. So it's not just about getting urine on the stick, but respecting that specific chemical process time frame. It's like a precise little science experiment happening right there in your bathroom.
Exactly. Think of it like baking a cake, like you said before. You wouldn't pull it out of the oven 5 minutes early hoping it's done right.
Definitely not.
Yeah.
Raw cake center.
Exactly. Or leave it in way too long, potentially burning it. Precise timing is essential for the chemical reaction to properly develop and give you an accurate reading. My advice is super simple. Set a timer. Use your phone, use a kitchen timer, whatever. Don't get distracted by your phone notifications, a quick scroll through Instagram, or anything else during that crucial waiting period. Just set the timer and, try to relax for a few minutes.
Good advice. Just wait it out properly.
And also, a common concern people have is whether they peed too much or maybe not enough on the stick.
Yeah, did I flood it?
Right. Don't worry too much about oversaturating it. Most tests have a control line. This is designed specifically to indicate if the test was saturated correctly and, crucially, if the test itself is working properly.
The backup check.
It's the built-in safety check. If that control line doesn't appear at all within the specified time frame, it's a clear sign that the test is faulty. Maybe it was stored incorrectly in extreme temperatures, maybe it's expired even if the date looked okay, or maybe it's just a defective test from the factory. In that case, you should discard it immediately and try a new one. Don't trust any result if the control line isn't there.
That's really good to know, especially for those anxiety-fueled moments when you're second-guessing absolutely everything you did. So, okay, even with perfect technique, following all the rules, sometimes tests can still give confusing results, right? Which brings us to understanding what a false result truly means. So beyond the expired test or maybe not reading the instructions properly, what's the #1 reason people get a negative result when they are in fact pregnant? It seems like it must be a really common scenario given how much anxiety these tests can create, seeing that negative when you feel pregnant.
You're absolutely right. It is very common. The most prevalent reason by far for false negative pregnancy test is simply testing too early. Your HCG levels just haven't had enough time to build up to a detectable level for that particular test to register.
So the hormone's there, just not enough of it yet.
Exactly. Even the most sensitive home pregnancy tests, the early result ones, typically need HCG levels to reach at least, say, 20 milli-international units per milliliter, MI/UML, to give a positive result. Some are 25, some might be slightly lower, but there's always a threshold. If your levels are below that specific test's threshold, even if you are definitely pregnant, the test won't pick it up. It'll show negative.
Okay.
And while HCG is produced relatively quickly after implantation, remember, as early as 6 days post-conception, It takes time for it to accumulate and reach that specific threshold in your urine. For most singleton pregnancies, this detection threshold is usually reliably met around weeks 4 or 5 of pregnancy.
Which is usually around the time of your missed period.
Typically, yes. That's why waiting is key.
Yeah.
If you test before this, especially several days before your expected period, or even just right around the very first day you think you missed it, you're essentially looking for a needle in a haystack before enough needles have actually arrived to be easily spotted.
I can definitely see how that patience factor would be key here. It's incredibly hard to wait when you're anxious for an answer or when you feel like you just know something is different in your body.
It truly is, and it's completely understandable. That 2-week wait can feel like an eternity.
Right?
And to dive a bit deeper into the biology here, sometimes you might even think you've missed your period based on your usual cycle length, but if you happen to ovulate later than you thought that month,
Which can happen.
oh, absolutely. Stress, travel, illness, lots of things can shift ovulation. Or if implantation itself happened on the later side of the typical window, remember that 6 to 12 day range.
Yeah.
If it happened closer to day 12, then your missed period day might still be technically too early for a reliable reading because HCG production started later. Also, don't forget, sperm can live inside the fallopian tubes for up to 5 days.
Days. Well,
Yeah. So conception itself could happen several days after intercourse took place. All this natural biological variability means your body might just need a few more days to produce enough HCG to register clearly on that home test.
okay, so many moving parts.
So many. So for you, the listener, this is where patience truly pays off. If you suspect pregnancy but get a negative result, the very best first step is usually to simply wait a few more days, say 2 to 3 days, or even a full week if your period is very irregular, and then retest with a new test, preferably using that concentrated first morning urine.
Right. Give it another shot.
Your body will likely have accumulated significantly more HCG by then, giving you a much clearer and more definitive answer, and hopefully reducing that period of uncertainty and worry.
That's a great, actionable piece of advice. Wait, then retest. But okay, you mentioned something earlier that sounded really counterintuitive. There's a fascinating and quite rare reason for a false negative that goes against everything we think we know about pregnancy hormones. Having too much HCG. Let's get into that. Hashtag 3.2, the curious case of the hook effect. This one sounds wild to me, seriously. My intuition tells me that if you have more pregnancy hormone, buckets of it, it should be easier for the test to say you're pregnant, not harder. Can having too much actually make a test say you're not pregnant, or maybe give a super faint, confusing line?
It sounds completely unbelievable, doesn't it? It goes against all common sense, absolutely. But yes, it is a real, albeit rare, phenomenon known as the hook effect, and it can definitely happen.
The hook effect. Okay, what is that?
The hook effect, sometimes called the high-dose hook effect, occurs when HCG levels are extraordinarily high. We're talking seriously high, like above 500,000 milli-international units per milliliter, MIUML, maybe even higher.
Whoa, okay. That's a lot compared to the 20 MIUML threshold you mentioned.
Exactly, orders of magnitude higher. At these incredibly high concentrations, the hormone can actually overwhelm the test's detection system. It basically prevents the home pregnancy test from properly interpreting the result. So instead of getting a clear, strong positive line, you might get a negative result, or sometimes a paradoxically very faint line that's easily missed or misinterpreted as an evaporation line. This can lead to a lot of confusion and potentially delayed diagnosis.
So the test basically gets flooded with too much information, like its circuits are overloaded and it can't process the sheer volume.
That's a very good way to put it. Yeah, flooded or overwhelmed. The test strips typically work using 2 main types of antibodies. One antibody captures the HCG molecule, and another one detects it and produces the color change. In the hook effect, when there's an overwhelming amount of HCG, both of these crucial binding sites on the antibodies become completely saturated, just swamped with individual HCG molecules. This prevents them from forming the necessary sandwich complex, where one antibody grabs the HCG and the other detects the grabbed HCG that's required to produce a visible colored line. It's like having way too many keys trying to jam into the same lock all at once. Nothing works correctly. The mechanism gets blocked.
Wow. Okay, so when would HCG levels ever get that high? What causes that?
Good question. This phenomenon typically occurs in 2 main scenarios. The first, and perhaps most relevant to our conversation about why it's so counterintuitive, is if you're pregnant with twins or other multiples, like triplets or quadruplets.
Oh, on multiple.
Yes. When you're carrying more than one baby, your body naturally produces significantly higher levels of HCG compared to a singleton pregnancy, sometimes reaching those very high concentrations that can potentially overwhelm the test.
So thinking you have twins could lead to a negative test.
Yeah.
That's mind-bending.
It really is. The hook effect can also happen if you are much further along in a singleton pregnancy, specifically when HCG levels naturally peak during the first trimester, which is usually around 8 to 11 weeks gestation. Levels can get very high then, before they start to plateau and decline slightly.
Okay.
And then, more rarely and more seriously, it's sometimes associated with a molar pregnancy.
You mentioned that briefly before. What is that again?
A molar pregnancy is a rare complication where abnormal cells, instead of a healthy embryo, grow in the uterus. It's a type of gestational trophoblastic disease. These abnormal cells produce excessively high HCG levels, often much higher than even a multiple pregnancy. In these cases, the extremely elevated hormones can also trigger the hook effect, leading to a confusing false negative or faint positive on a home test.
That sounds serious.
It is, and requires medical management.
So this hook effect, that's truly remarkable. I think most people, myself included, would just assume a stronger positive if HCG levels were super high. Are there actual documented cases of this happening, or is it mostly theoretical, like a lab curiosity?
Oh, no, there are definitely documented cases. It's not just theory. For example, a case study was published in the medical journal Curious back in 2022. It described a woman who went to the emergency room with severe nausea and vomit, classic hyperemesis, really extreme morning sickness.
Right.
Despite her very strong pregnancy symptoms, she repeatedly got negative urine pregnancy tests in the ER. They kept testing, kept getting negatives. Eventually, subsequent ultrasounds revealed that she was actually pregnant with triplets.
Triplets. Wow.
Yeah. And the hook effect was theorized as the most likely reason for those initial false negatives that baffled the ER docs for a bit. While Dr. Al-Rahmani, the OB-GYN we mentioned, notes she's never personally seen a clear case of the hook effect from multiples in her practice causing a misdiagnosis, the possibility certainly exists, and this case study highlights that it can have real-world implications, potentially delaying diagnosis and appropriate care, like getting treatment for that severe nausea.
That's incredible.
And the main concern with the hook effect, really, and why it's so important to be aware of, even though it's rare, is precisely that. It can delay prenatal care. A woman might understandably believe she isn't pregnant based on a negative home test, especially if she takes it later in the first trimester, and therefore might not seek the necessary medical attention or start prenatal vitamins.
Right, you just assume the test is right.
Exactly. This really underscores the importance of consulting a healthcare provider if something doesn't feel right, if you're experiencing strong pregnancy symptoms despite getting a negative test result, or if your symptoms are extreme, like that severe hyperemesis gravidarum where very high HCG levels are common. Trust your body. Trust your intuition. A negative test isn't always the final word if symptoms suggest otherwise.
That really reinforces the message that these tests are incredible tools. Fantastic science, but they're not the only piece of the puzzle. Your symptoms and your doctor matter too. Okay, now let's flip the script entirely and talk about the other side of the coin. The unexpected positive or false positives. Okay, so we've established that false negatives can be pretty common, often due to simple things like user error or testing too soon. What about the opposite scenario? How often does a test say you're pregnant when you're actually not? What's the likelihood of a genuine false positive?
That's a great question. And the good news is that true false positives are much, much rarer than false negatives. They make up a very small percentage of inaccurate results from home pregnancy tests.
Okay, that's reassuring.
It is. Home pregnancy tests are generally very, very good at their primary job, which is detecting HCG. They're highly specific to that hormone. So if a test shows a positive result, it almost always means some form of HCG is present in your urine. The test isn't usually lying about the hormone being there. The crucial point here, the nuance, is that a positive result fundamentally means HCG is present. However, if you're not experiencing what would be considered a viable ongoing pregnancy that will continue to term, then the presence of that HCG can be attributed to several different factors. Some of these are related to very early pregnancy complications or non-viable pregnancies, and others, though rare, are completely unrelated to pregnancy altogether.
So it's not always the test that's false, perhaps, but maybe the implication of that positive result can be misleading if you don't understand the various reasons why HCG might be present.
That's a perfect way to put it. It's about understanding why the HCG is there. The test detected it accurately, but what does that detection signify in your specific situation?
Okay, that makes sense. It's reassuring in a way that a positive is usually indeed detecting something. But it sounds like not experiencing a viable pregnancy is a key distinction here.
It absolutely is. Let's transition now into breaking down the most common and also some of the more serious reasons why you might get a positive result that isn't indicative of a healthy, progressing pregnancy that will lead to a baby.
This first one is something I've heard about, and it sounds incredibly tough emotionally for anyone experiencing it. Can you explain what a chemical pregnancy actually is and how it relates to getting a positive test result?
Indeed. It can be very difficult. A chemical pregnancy is essentially a very early miscarriage. This occurs when an embryo forms, maybe even starts to implant briefly in the uterus, and that initial implantation process initiates the release of HCG.
So the body thinks it's pregnant.
Yes, for a short time. And when this implantation occurs, even if it's very fleeting, it releases enough HCG into the bloodstream and urine to trigger a positive home pregnancy test, especially if you're using an early, sensitive test. However, for various reasons, most commonly due to severe genetic or chromosomal abnormalities within the embryo itself, meaning it just wasn't viable from the start, it then stops developing very shortly after that initial implantation attempt, sometimes even before a woman technically misses her period.
Wow, so it can happen really, really early.
Incredibly early. And the critical thing to understand here is that because it happens so early, often before a woman even officially misses her period, or just right around the time she would expect it, many women might not even realize it occurred.
How so?
Well, they might get a faint positive test, maybe test again a day or two later, and it's still faint or even gone, and then they experience what they perceive as a normal or perhaps slightly delayed or heavier period shortly after. If they retest after the bleeding starts, they'll get a negative result. It's estimated that chemical pregnancies might impact as many as 1 in 4 pregnancies, possibly even more. They're just often undetected. This means it's a very common, though often silent, experience. But for individuals who were actively trying, who saw that positive line, even a faint one, it can be incredibly confusing and heartbreaking.
So, just to clarify, it's not really a false positive in the sense that the test was wrong or malfunctioning.
Yeah.
It's that a pregnancy did start, biologically speaking, releasing HCG, but then unfortunately ended very, very quickly. That distinction seems really important for understanding what your body is doing.
Precisely. That distinction is vital. For you, the listener, if you test early, get a faint positive, maybe even a couple of faint positives, and then experience your period, which might feel normal or slightly different, and a subsequent negative test, a chemical pregnancy could very well be the explanation. It's important to acknowledge this as a real loss, though often silent, in the journey of conception. These early losses are typically due to the embryo simply not being viable, and your body is efficiently doing its job by naturally resolving a non-progressing pregnancy. While undoubtedly heartbreaking, chemical pregnancies are generally not medically concerning in the long run for future pregnancies, and they don't typically impact your ability to conceive again successfully.
That's good to know, at least.
However, other reasons for positive tests that don't result in a healthy baby can be more serious and require immediate medical attention.
You mentioned some more urgent reasons for a positive test that isn't a standard pregnancy. What are those conditions, and why are they so critical to identify quickly?
These are indeed conditions that produce HCG and therefore will give you a positive pregnancy test, but they are not viable pregnancies, and critically, they require immediate medical attention because they pose potentially severe health risks to the mother.
Okay.
What are they? First, let's talk about ectopic pregnancy. This is a relatively common complication occurring in maybe 1–2% of pregnancies. It happens when a fertilized egg implants outside of the uterus.
Outside.
The most common location by far is within one of the fallopian tubes. That's often called a tubal pregnancy. But implantation can also occur on the ovary, on the cervix, or even floating in the abdominal cavity attached to other organs.
Wow.
While an ectopic pregnancy will definitely produce HCG, leading to a positive test result, the embryo simply cannot develop properly in those locations. It's physically impossible for it to survive and grow there, and it poses a danger as it gets bigger.
Okay, so what are the warning signs? How would you know?
The critical information to recognize are the symptoms that often go beyond the typical early pregnancy signs like nausea or breast tenderness. An ectopic pregnancy will frequently present with specific red flags. These include persistent vaginal bleeding or spotting, which might be light or heavy, brown or red, and importantly, pain.
What kind of pain?
It can range from a dull ache to a sudden, sharp, stabbing pain. It might be felt primarily in the abdomen, often localized to one side, but it can also be felt in the lower back, the pelvis, or sometimes referred pain up in the shoulder tip or even the neck. That shoulder pain is a classic sign of internal bleeding irritating the diaphragm.
Shoulder pain. Okay, that's unexpected.
It is, but it's a key sign. If you experience these symptoms, bleeding, abdominal pelvic pain, shoulder pain, along with the positive pregnancy test, it signals a medical emergency.
Why is it an emergency?
The critical implication here is that as the misplaced embryo grows, it can stretch and eventually cause the fallopian tube, or wherever it's implanted, to rupture or burst. This leads to potentially life-threatening internal bleeding into the abdomen. Diagnosis is usually confirmed via ultrasound to see where the pregnancy is located or if the uterus is empty, and serial quantitative HCG blood tests to see if levels are rising appropriately. Treatment typically involved either medication like methotrexate to dissolve the pregnancy tissue or surgery to remove it, sometimes including the damaged tube.
Okay, that's serious. Early detection is key.
Absolutely vital. Secondly, there's molar pregnancy, which we touched on briefly. This is much rarer than ectopic pregnancy, but also serious. It's where the cells that would normally become the placenta develop abnormally, forming grape-like cystic tissue instead of a healthy placenta and embryo. There's no viable fetus developing.
So the test is positive, but it's not a baby growing.
Correct. Like ectopic pregnancies, molar pregnancies will initially show normal pregnancy symptoms, maybe even exaggerated ones due to very high HCG levels leading to that positive test. We even mentioned it can sometimes cause the hook effect because HCG can get so high. However, usually within the first 3 months, they typically present with distinct symptoms. These often include vaginal bleeding that can be bright red or dark brown, sometimes with passage of the grape-like cysts, and pelvic pressure or pain that might feel heavier or more intense than typical early pregnancy cramps. Sometimes nausea and vomiting can be more severe too.
So these are situations where the body's producing HCG. The test is accurate in detecting that hormone, but the pregnancy itself isn't developing as it should, and it poses a significant risk to the woman's health.
Exactly. The implications of a molar pregnancy are also serious. It requires surgical removal of the abnormal molar tissue, usually via a D&C procedure, and it's crucial to have follow-up care afterwards, monitoring HCG levels down to 0 to ensure no abnormal tissue remains, as rarely it can develop into a persistent or cancerous form called choriocarcinoma.
Okay.
So the most important call to action for you, the listener, is this. If you have a positive home pregnancy test and you experience any of these concerning symptoms, unusual vaginal bleeding, especially if it's heavy or persistent, significant abdominal or pelvic pain, sharp shoulder pain, severe nausea, vomiting, or dizziness, fainting, please seek immediate medical attention. Go to an ER or urgent care or call your doctor right away. Do not delay. Early diagnosis and treatment for both ectopic and molar pregnancies are absolutely crucial for your health and safety.
That's a vital warning. Thank you. Beyond these specific pregnancy-related conditions, it's also worth noting that there are other less common, maybe non-pregnancy related reasons for a positive result, right?
Yeah.
Hashtag 4.4 other medical factors. So are there any reasons completely unrelated to any kind of pregnancy viable, chemical, ectopic, or molar that could cause a positive pregnancy test result? This seems incredibly unlikely, but I'm curious if it's even possible.
Yes, though again, these are quite rare. There are indeed non-pregnancy related medical factors that can cause HCG to be present in your system at detectable levels and thus lead to a positive home pregnancy test.
Okay, like what?
Well, this covers a few different areas. For instance, somewhat surprisingly, women who are undergoing menopause or perimenopausal can sometimes have slightly elevated levels of HCG produced by the pituitary gland. These levels can occasionally be high enough to be detected by a sensitive home pregnancy test, even though they are certainly not pregnant.
Menopause. Really?
Yeah, it's an unexpected but real physiological change that can sometimes lead to confusion if someone in that age range were to take a test.
Okay. What else?
Then there are certain medications. This is probably more common than the menopause scenario. Fertility medications, specifically those used to trigger ovulation during treatments like IVF or IUI, frequently contain HCG itself. That's literally the drug's active ingredient.
Ah, so you're injecting the hormone the test looks for.
Exactly. So if you test too soon after receiving one of these HCG injections, often called a trigger shot,
Yeah.
you can get a false positive result because the test is simply detecting the residual medications still circulating in your system, not HCG from a new pregnancy.
How long does that take to clear?
It usually takes about 10 days to 2 weeks for the trigger shot medication to clear completely from your urine, but always follow your fertility clinic's specific instructions on exactly when it's safe to test after such an injection to avoid this confusion.
Good tip. Any other medications?
Additionally, while rare, certain chemotherapy drugs can sometimes cause hormonal changes or interfere with tests. And in very specific, uncommon cases, certain types of tumors, particularly germ cell tumors of the ovaries or tests, or other tumors that mimic placental cells, can actually produce HCG.
Tumors can make pregnancy hormone. Wow.
Yes, it's a known tumor marker for certain cancers. So it's not the medicine causing a pregnancy, as you clarified, but the HCG within the medicine or produced by a non-pregnancy related condition like a tumor. That's a subtle but important distinction.
Definitely.
Exactly. The test is simply doing its job by detecting the HCG molecule it's designed for, whatever the source. Lastly, there are some other rare medical conditions beyond tumors. Things like gestational trophoblastic disease, which we mentioned includes molar pregnancy, but also other forms of abnormal placental tissue growth, severe kidney disease, which can affect how HCG is cleared from the body, potentially some forms of liver disease, and even some very specific genetic conditions can also cause HCG to be present or falsely elevated in the bloodstream and, consequently, in the urine.
Okay, so a whole range of rare possibilities.
Very rare, but they exist. The relevance to you, the listener, is really not to panic or jump to conclusions if you get a positive result that seems completely out of place or doesn't align with your situation, your cycle, or the symptoms you're experiencing or not experiencing.
Yeah.
Instead, it's important to be aware that a medical professional is the one who can help uncover the true cause. They have the tools like specific blood tests that can sometimes distinguish between different forms of HCG, like pituitary HCG versus pregnancy HCG, imaging, and other diagnostics to get to the bottom of what's truly going on. Your positive test result is likely real in that it detected HCG, but its meaning might require medical investigation to clarify.
That's really important to keep in mind, that a positive isn't always what you expect, and the doctor is key. Knowing these medical reasons is vital. But sometimes the confusion comes less from complex medical issues and more from how people interpret or even try to manipulate the test itself. Let's talk about that.
All right, let's tackle a common question that definitely pops up, especially maybe if you're trying to save money or you got a really faint line and you just want to double check it later. Can you just, dip that same stick back in your urine sample the next morning or later the same day for a second reading? Reuse it.
That's a categorical and emphatic no. Absolutely not. Pregnancy tests are designed strictly for a single use only,
Right.
period.
Okay, crystal clear. Why not?
Attempting to reuse a test means you absolutely cannot rely on any results you might get the second time around. You are highly likely to receive an inaccurate reading. This could be due to seeing a misleading evaporation line as the old urine dries further, or perhaps getting no lines at all because the chemical components are exhausted, or even seeing weird splotches. The control line certainly won't work reliably again, so it's fundamentally broken after one use.
Fundamentally, the core information here goes back to how these tests operate. The chemical reaction that detects HCG happens once. The antibodies on the test strip react with any HCG in your urine during that first exposure, and that reaction is essentially spent after its initial use. The reagents, the chemicals involved, are used up in that first reaction.
Right.
Once it's reacted or even just been exposed to urine and the test chemistry has been activated, the test strip's detectors are no longer reliable. The chemical system has been activated and has completed its process. It's finished.
So it's not like a reusable coffee filter or a sponge where you can just wash it out and use it again. It's a one-and-done chemical process where the specific chemicals are actually consumed or permanently changed after that first use.
Precisely. Think of it like trying to relight a match that's already been struck and burned. Once it's burned, it's done. It just won't work correctly or reliably the second time around.
Makes perfect sense.
And specifically about that control line we mentioned earlier, the one that confirms the test is working properly. If you've already used the test once, that control line has already appeared, or should have. It won't reappear correctly or serve its purpose to confirm the validity of a second attempt on the same strip. The test is essentially a blank, or rather, a used and unreliable slate the second time around. If you need to test again for any reason, Always open a fresh, new test from its sealed packaging. It's truly worth the extra dollar or two for accurate information you can actually trust.
Yeah, it's a clear warning. Don't do it. And if reusing is a definitively bad idea, so are some of the more unusual attempts people make to interpret faint lines through digital means, right? This tweaking thing.
Yeah, this is a trend I've definitely heard about online, especially in forums and social media groups where people are trying to conceive what exactly is tweaking a pregnancy test and does it actually work in any kind of reliable way? Or is it just hope? Right, tweaking. It involves taking a photo of a pregnancy test result, usually one that looks negative or have an extremely faint, maybe ambiguous line, and then digitally editing that photo using software on your phone or computer.
Editing it how?
This often means adjusting things like the brightness, the contrast, the saturation, the sharpness, messing with the shadows, maybe even inverting the colors, all in an effort to try and reveal or enhance a faint second line that isn't clearly visible to the naked eye.
Okay.
It's a practice that's really born from understandable anxiety and a very strong, often quite desperate desire for earlier answers during that agonizing 2-week wait. But let me be unequivocally clear again. It is not a scientific or medical technique in any way, shape, or form, and it is highly, highly unreliable, often leading to more distress and confusion than clarity.
Okay, so absolutely no science behind it. Why is it so unreliable?
Well, the core information here is that there are absolutely zero scientific studies supporting the accuracy of pregnancy test tweaking. None. The results you get are purely subjective. What one person sees as a line, another might not, and they're incredibly prone to misinterpretation due to several factors.
Like what kind of factors?
For one, you can easily create or enhance what just appear to be false lines. These could be indentation lines where the antibody strip is, or they could be from inactivated dye that didn't wash away properly on the test strip, or maybe from tiny urine splashes, or even from dye run that occurs during the test process itself if the test gets oversaturated. Editing can make these artifacts look like real lines.
So you're just amplifying imperfections in the test.
Pretty much. Secondly, the editing software itself can introduce distortions or artifacts into the image, making you think you see something that isn't actually there in reality. There could also be minor manufacturer variations or inconsistencies with the test strip itself that could be misinterpreted when you manipulate the image so heavily.
So it's less about actual detection of HCG and more about optical illusions, maybe wishful thinking. Then it sounds like it could really feed into the anxiety rather than alleviating it.
Sadly, yes, that's often exactly what happens. It creates a vicious cycle. And perhaps most importantly, there's that significant psychological factor of wishful thinking or confirmation bias. When you're eagerly, desperately hoping to see a positive result, your brain can sometimes perceive a line that isn't truly there, or it can interpret ambiguities in the digitally altered image as positives.
Yeah, you see what you want to see.
Exactly. And while the online communities dedicated to tweaking might offer various tips, like always using pink ink tests because they supposedly tweak better than blue ones, or avoiding color inversion because it shows false lines, medical professionals universally caution against this entire practice. The perceived line that someone brings out through heavy editing often turns out to be absolute nothing, just an artifact. Or worse, if it happens to represent a very early chemical pregnancy, it can lead to deeply heartbreaking false hope, followed by crushing disappointment.
That sounds emotionally exhausting.
It really can be. The speculation and extrapolation here are that while tweaking might offer a momentary, fleeting sense of hope or reassurance, maybe there is a line, it can create significant emotional distress in the long run. It often leads to false hope, prolonged uncertainty as you test and tweak day after day, and a deeper sense of disappointment when that tweaked line ultimately turns out to be inaccurate or doesn't progress.
So what's the advice for listeners?
For you, the listener, if you find yourself obsessing over tweaking tests, spending hours editing photos, comparing them online, it might actually be a powerful sign to step back. Maybe consider seeking support from a therapist, perhaps one specializing in fertility counseling or anxiety management. This cycle of tweaking often creates far more anxiety than it ever relieves, becoming almost a compulsive behavior that just feeds into the stress rather than providing genuine, reliable answers. Waiting a day or two and retesting with a fresh test is always the more reliable approach.
That's a very empathetic and important point. The psychological toll of the 2-week wait is immense for so many people. And related to tweaking, I think, is another online trend involving looking for something called a dye stealer. What's that about? Okay, what exactly is a dye stealer in the world of pregnancy tests, and why are people online sometimes so obsessed with trying to get one, maybe even taking multiple tests a day hoping to see it happen?
Right, the dye stealer. It's when the positive test line on a 2-line pregnancy test appears significantly darker, sometimes even dramatically darker, than the control line. The idea is that the test line has become so strong because there's so much HCG that it has seemingly stolen the dye away from the control line, making the control line look lighter in comparison.
Ah, okay, so the test line is darker than the reference line.
Exactly. And it's become a pretty significant trend in hopeful parenting communities and among those deep in the throes of the 2-week wait. Individuals will often take daily tests, sometimes even multiple times a day, looking for this progressively darker line, and specifically the dye stealer, as a personal, though completely unconfirmed indicator of a sticky baby, meaning a strong, healthy pregnancy, and a sign that the pregnancy is progressing well. This is especially common when they don't have access to frequent quantitative blood tests from a doctor to monitor HCG levels directly.
So it's like a DIY way to track if things are going well.
That's the hope behind it, yes. But the core information to understand here is that while it's absolutely true that HCG levels do rise rapidly as a healthy pregnancy progresses, and theoretically this could make the test line appear darker over time, home pregnancy tests are fundamentally not designed to precisely measure HCG concentration.
Say that again, they're not designed for that.
Correct. They are primarily qualitative tests, not quantitative ones. Their main purpose is to tell you if HCG is present above a certain minimum threshold, like that 20 or 25 MIU/mL we talked about. They are not built or calibrated to give you an accurate, reliable measure of the exact amount of HCG in your urine or to accurately reflect the rate of increase day by day.
So even if the line looks darker, maybe even becomes a dye stealer, it's not truly a scientific measurement of how much HCG is there or how fast it's rising. That seems important to clarify because the visual can be so compelling and incredibly reassuring if you see it getting darker.
Exactly. The visual can be very deceptive or at least not reliably informative in the way people hope. As Dr. Alex Robles, a fertility expert, puts it quite clearly, the darkness of the line can loosely reflect rising HCG levels, but home tests aren't designed to measure that precisely.
Right.
The actual darkness of a test line is influenced by many other factors that have absolutely nothing to do with the health or viability of the pregnancy. Things like your urine concentration at that specific moment, even first morning urine, can vary slightly in concentration day to day. There can be batch variations between different tests, even from the same box. Different brands have different sensitivities and dye amounts. And even the exact timing of when you read the test within the result window can affect perceived line darkness. It is simply not a reliable indicator of pregnancy health or viability.
Okay, so chasing the dye stealer might be misleading.
It can be very misleading and cause unnecessary worry. Expanding on this, doctors and fertility specialists consistently warn that relying on dye stealers for reassurance can lead to a lot of needless anxiety and distress. For example, it's crucial to know that not every perfectly healthy pregnancy will produce a noticeable dye stealer. Some women just don't get them. Their lines get dark, but maybe never darker than the control, and that's perfectly normal for them. Secondly, seeing an early dye stealer does not reliably predict twins or multiples, even though we know multiples often have higher HCG levels. Many singleton pregnancies also result in strong early dye stealers, and conversely, not all twin pregnancies will show this phenomenon early on. It's just not a reliable predictor.
Good to know.
And lastly, that hook effect we discussed earlier, where extremely high HCG levels might cause a faint line or even a false negative. That is very real and typically requires HCG levels far, far beyond what most women reach in the early weeks when they are typically doing home testing. It's not something you should generally anticipate or worry about when looking at early line progression. You're much more likely not to experience the hook effect.
It sounds like another situation, much like tweaking, where the understandable human desire for reassurance, for some sign that everything is okay, can actually backfire and create more stress, maybe leading to compulsive daily testing.
It's precisely that. This practice, while stemming from a completely understandable desire for reassurance, can easily backfire. It often causes more anxiety than it alleviates. The momentary relief you might feel from seeing a slightly darker line is often very brief, and it can lead straight into a compulsive cycle of retesting every single day, sometimes multiple times, constantly scrutinizing lines, comparing photos, chasing that elusive dye stealer, and ultimately increasing emotional distress and contributing to significant burnout, during what should ideally be a hopeful, albeit uncertain time.
Yeah, it sounds exhausting.
It really can be. The only time a doctor might really be concerned based solely on home test line progression is perhaps if the line gets markedly and consistently lighter over several consecutive days. And even then, one slightly lighter test isn't definitive cause for alarm without other symptoms like bleeding or cramping. A blood test would be needed for real answers.
That's a really good distinction to make.
Mm-hmm.
Okay, so if digital tweaks and dye observations are unreliable, bordering on unhelpful, what about those truly DIY kitchen sink concoctions people sometimes try? Okay, I have definitely seen countless videos and blogs and social media posts about homemade pregnancy tests, using things from around the house like baking sodas, salt, sugar, shampoo, toothpaste, even horrifyingly bleach. Do any of these actually work, or are they just dangerous urban legends passed around online?
Let's be unequivocally clear on this point because it's really important for safety. Experts stress universally that homemade pregnancy tests are not reliable and should never ever be used in place of legitimate, properly manufactured over-the-counter options. These methods are often born out of curiosity, maybe a desire to save money, or sometimes, unfortunately, a lack of access to proper tests. But they are completely unproven scientifically and, in some cases, actively unsafe.
So zero science behind them. How are they supposed to work?
Well, the theory, if you can call it that, is that these methods involve mixing your urine with various common household items like the baking soda, salt, sugar, shampoo, toothpaste, or vinegar you mentioned, and then observing for some kind of reaction, maybe fizzing, maybe clumping, maybe foaming, maybe a color change.
Right.
But the critical point is that none of these reactions are backed by any scientific research whatsoever. They are not designed to detect HCG, the pregnancy hormone. Any observed reaction is purely coincidental. It's usually just a result of basic chemical interactions between the acids or other components in your urine. These reactions have absolutely no bearing on your pregnancy status.
So it's not just ineffective, but potentially dangerous. You mentioned bleach. That sounds particularly bad.
Absolutely. It's not just ineffective. Some are dangerous. We must highlight the extreme danger of one particular method, the bleach test. Mixing household bleach with urine is extremely dangerous. Why? Because urine naturally contains ammonia. When bleach and ammonia combine, they react to create highly toxic chloramine gas.
Toxic gas.
Yes, toxic fumes that are extremely harmful if inhaled. It can cause severe respiratory irritation, chemical burns to your lungs, and potentially much worse outcomes. Do not try this test under any circumstances. This isn't just about getting unreliable results. It's a serious health hazard. Please, nobody try mixing bleach and urine.
Okay, wow. That's a crucial warning. Stay away from the bleach test.
Please. And it's interesting, just as a historical aside, the only ancient method of pregnancy testing that even had a tiny bit of limited later research suggesting some potential, though still poor, correlation was the ancient Egyptian wheat and barley test.
What was that?
Women would urinate on separate piles of wheat and barley grains over several days. If the grains sprouted, it supposedly indicated pregnancy. Some modern small studies looking back at this historical method found it successfully predicted pregnancy maybe about 70% of the time.
70%. Better than guessing, I suppose, but...
Right. Better than 50-50, maybe, but still nowhere near the 99% accuracy rate claimed by modern home pregnancy tests when used correctly. It just highlights how far science has come and how incredibly unreliable these homemade or ancient methods truly are in comparison to the precise antibody-based detection of modern tests.
Yeah, 99% versus maybe 70% or just random chance of baking soda, no contest.
No contest at all. Therefore, our recommendation is unwavering. If you've missed a period or suspect you might be pregnant, your best bet, your only reliable bet for home testing, is to use a legitimate, FDA-cleared home pregnancy test. Even the cheapest generic ones you can find at the dollar store are remarkably reliable when used correctly, following the instructions and checking the date. They are vastly superior to any homemade concoction. Don't let cost deter you from accurate information. As we'll discuss, there are affordable and even free options available.
That's a crucial message to hear. It's truly amazing that something so complex, chemically speaking, is available so readily and affordably these days. So with all this information now about what works, what doesn't, what's reliable, and what's risky, what should you do if you're still uncertain about your pregnancy status after following all the best practices for home testing? Where do you go from there?
Okay, so let's say I've taken a home pregnancy test. Maybe I followed all the rules, checked the date, used morning urine, waited the right amount of time, and I still get a negative result, but I really feel pregnant. Or maybe I got a super faint, ambiguous line that I just can't be sure about. What's my very next step after listening to this deep dive? What's the immediate, most logical thing to do before starting to, freak out?
Right, great question. Your first and most straightforward action should almost always be to simply retest at home. Don't jump immediately to worst-case scenarios.
Just try again. Just try again, but with a bit of strategic waiting. If you initially received a clear negative result, especially if you tested on the early side, like right on the day of your missed period or even before, the best recommendation is usually to wait a few more days. Typically, 3 to 7 days is a good window.
Okay, give it a few days to a week.
Exactly. Then take another test. This waiting period allows your HCG levels, if you are pregnant, to continue that rapid doubling we talked about, hopefully reaching a clearer, much more easily detectable level for the test next time. If you had a faint or unclear line initially, you can often retest even sooner, perhaps just in a day or two, because your HCG levels, if you are indeed pregnant, should be rising rapidly, making that faint line become darker and more obvious pretty quickly.
Okay.
The core information here is that many home pregnancy tests are actually sold in multi-packs, often 2 or 3 tests per box, for this very reason. Manufacturers understand that initial results might be unclear, or that people often want or need to retest for confirmation or peace of mind.
Right, they know we're going to test again.
Exactly. Waiting just that short time allows more HCG to accumulate in your system, significantly increasing the likelihood of getting a clear, unambiguous positive result if you are pregnant. This simple act of retesting after a strategic waiting period can often resolve much of the initial uncertainty and reduce that cycle of anxious speculation and worry.
That makes perfect sense. It's like giving the hormone signal a little more time to broadcast strongly enough for the receiver, the test, to pick it up clearly.
Perfectly put.
But, okay, let's say I've done that. I waited, I've retested, maybe even a couple of times, and the home tests continue to be confusing, maybe still faint, maybe negative despite symptoms, or perhaps have other concerns, like some of those symptoms we discussed earlier, that don't quite add up with a simple pregnancy. That's when it's definitely time to involve a healthcare provider.
Right. Precisely. Once you've retested at home following best practices and you still have questions, nagging concerns, or symptoms that don't align with your test results or lack thereof, it's absolutely time to escalate. Involve your healthcare provider, your doctor, a nurse practitioner, a midwife, or a clinic. They have more advanced tools and the clinical expertise to provide definitive answers and guide your next steps appropriately. Don't hesitate to make that call. Hashtag 6.2, the role of blood tests and ultrasounds.
So if the home tests aren't giving me a clear answer, or if I have symptoms maybe like pain or bleeding that just don't match what the test is telling me, what's next from the medical perspective? What can my doctor actually do that a simple pee-on-a-stick test can't?
Right. Your doctor or healthcare provider has more sensitive and definitive tools at their disposal to provide clear answers and assess the situation more fully. These primarily include blood pregnancy tests and, usually at a slightly later stage, pelvic ultrasounds. These professional tools can offer insights and levels of detail that no home urine test could ever provide.
Okay, let's start with blood tests. How are they different?
Blood pregnancy tests are significantly more sensitive than urine tests. The main reason is that they detect HCG directly in your bloodstream, where concentrations are often higher and become detectable earlier than in urine, which is essentially filtered blood.
How much earlier?
They can often detect HCG as early as 6 to 8 days after ovulation, so potentially a few days to even a week sooner than most home urine tests can reliably pick it up. There are 2 main types of blood tests your doctor might order. First, there's a qualitative HCG blood test. This one is pretty straightforward. It simply confirms the presence or absence of HCG in your blood, giving you a simple positive or negative result, much like a urine test, but potentially sooner and with higher sensitivity. The results for these can often come back quite quickly, sometimes even the same day.
Okay, positive or negative, but from blood. What's the other type?
The second type is the quantitative HCG blood test, which you'll often hear called a beta HCG or sometimes a serum quantitative test. This one is even more precise and incredibly valuable in many situations. It doesn't just tell you if HCG is present, it measures the exact amount of HCG circulating in your blood, providing a specific numerical value like, say, 100 MIU/ml or 5,000 MIU/ml.
So it gives you a number.
Exactly, it gives you a number. And this is widely considered the most accurate way to confirm pregnancy very early on, and crucially, to monitor early pregnancy progression. Doctors often order these tests serially, meaning maybe 2 tests done 48 to 72 hours apart. They look to see if the HCG levels are doubling as expected within that time frame, which is a key indicator of a healthy, progressing intrauterine pregnancy. It's really the gold standard for early confirmation and monitoring, especially if there are any concerns.
That makes sense, tracking the actual rate of increase. And what about ultrasound? When does that come in?
Beyond blood tests, usually once you are estimated to be around, say, 6, 7, or 8 weeks pregnant, counting from the first day of your last period, an ultrasound, typically a transvaginal ultrasound early on for better resolution, can definitively confirm the pregnancy. And critically, it can confirm its exact location within the uterus.
So you can actually see it.
You can see it. This provides visual confirmation that no test strip can offer. The sonographer or doctor can look for the gestational sac, then the yolk sac inside it, and often, by that stage, the fetal pole, the first visual evidence of the embryo, and even a tiny flickering heartbeat. This visual is also absolutely vital for ruling out an ectopic pregnancy by confirming the pregnancy is safely inside the uterus.
Okay, so blood tests are more sensitive and can give you a number, track progression early, and ultrasound gives the visual confirmation and location check a bit later. That's clear. When would a doctor typically recommend going straight to a blood test rather than just telling you to retest with urine at home? Are they routine?
That's a good question. Routine blood tests aren't usually needed for every single pregnancy confirmation if someone has clear, positive home tests and no concerning symptoms. However, your healthcare provider might specifically order one, especially the quantitative beta HCG, in several situations. For example, definitely if your home urine test results have been consistently unclear, faint, or contradictory. A quantitative blood test can provide that definitive yes-no answer and establish a baseline level.
Okay.
It's also strongly recommended if there's any clinical concern about a possible ectopic pregnancy based on symptoms like one-sided pain or spotting, or if you have a history of a previous ectopic pregnancy or miscarriage. Tracking those quantitative HCG trends very closely with serial blood tests can help assess viability and location much earlier than ultrasound sometimes can.
Makes sense for high-risk situations.
Absolutely. Also, if you're experiencing any other concerning symptoms like unexplained significant abdominal pain, unusual bleeding, or dizziness, they'll likely do a blood test right away. And finally, if you're undergoing fertility treatments like IVF, quantitative blood tests are standard procedure. They're crucial for confirming pregnancy after embryo transfer and for monitoring the early stages very closely, often guiding medication adjustments. So basically, whenever precision, early detection, or monitoring of progression is clinically important.
That provides excellent clarity on when to escalate to professional medical help and what tools they have. And while these professional tests offer much more precision, let's just briefly touch on the costs involved, because that's often a practical factor for people, especially if they feel like they might be testing repeatedly at home or need further investigation. Hashtag 6.3, cost and accessibility of pregnancy tests.
Right. So do I need to break the bank to get an accurate pregnancy test? It really seems like there's a huge range in price when you're standing in the pharmacy aisle, from very cheap little strips to these fancy digital ones that promise all sorts of things and cost quite a bit more. Does price equal accuracy here?
That's a very common question and a totally valid concern. But the good news is absolutely not. You do not need to spend a lot of money for an accurate test. This is a common misconception that can add unnecessary financial stress during what's often already an emotional time.
Okay, tell me more. The core information is that, yes, home pregnancy tests range widely in price. You can get basic test strips, often in multi-packs online or at dollar stores, for less than $1 per test. Then you go up to maybe FortTime, $15 or even more for the ones with digital displays, maybe weak estimators, and fancier packaging.
Huge difference.
Huge difference in price, yes. However, the critical point is that all home pregnancy tests that are cleared by the FDA for sale in the U.S. claim to be around 99% accurate when used correctly according to their instructions, meaning typically testing on or after the day of the missed period, following timing rules, etc. The underlying antibody-based chemistry that detects HCG is essentially the same reliable technology across the board.
So the cheap ones work just as well.
For practical advice, yes, a cheaper test is generally just as accurate at detecting HCG as a more expensive one, assuming it's not expired and you use it correctly. Dr. Leon Al-Rahmani, the obgyn we mentioned earlier, even noted that in doctors' offices and clinics, they usually use the cheaper basic urine dipstick tests because they are perfectly reliable for confirming pregnancy.
So what are you paying extra for with the fancy ones?
The main difference you're paying for with a more expensive test, especially a digital one, might simply be the user experience and how clearly the results are displayed. Digital tests offer those unambiguous pregnant or not pregnant words right on the screen.
Which avoids the whole, is that a line, isn't it a line thing?
Exactly. It can significantly reduce the anxiety some people feel about interpreting faint lines or worrying about evaporation lines. They offer perhaps more psychological comfort and clarity in the readout, not necessarily inherently greater chemical accuracy in detecting the hormone itself.
That's a huge relief for many listeners, I'm sure, knowing they don't have to spend a fortune just to get a reliable yes or no. Are there even free or very low-cost options for people who might be facing financial difficulties or just want quick, confidential access without going through their regular doctor initially?
Yes, absolutely. And this is really important for accessibility. Many local public health clinics, community health centers, and family planning organizations, including well-known ones like Planned Parenthood, often offer free or significantly reduced cost urine pregnancy tests.
That's great.
They often provide confidential counseling and can connect you with other resources or prenatal care options as well, regardless of your ability to pay. This network exists to ensure that costs should never be a barrier for anyone needing to get accurate information about their pregnancy status and connecting with necessary health care. So don't hesitate to seek out these community resources if affordability or easy access is a concern for you. The most important thing is to get reliable information and support, not to spend a lot of money unnecessarily in the process.
That's incredibly empowering to know those options exist. Thank you. So, okay, once you've navigated this whole testing journey, maybe use some professional help if needed, and hopefully have a confirmed result, what's the most important thing to keep in mind moving forward from there? Hashtag dead tag outro. Wow, we have covered a lot of ground today in this deep dive, haven't we? From the fundamental science of HCG and how it actually interacts with that little stick, to the complex and sometimes really emotional reasons behind confusing or unexpected results. And we've even debunked some popular but ultimately unreliable online trends like tweaking and dye stealers. I think the main takeaway should be pretty clear for you listening. Timing your test really matters. Using that first morning urine is often best, especially for early detection. Always check those expiration dates and follow the manufacturer's specific instructions down to the minute. And please beware of unproven methods like digitally tweaking photos of tests or attempting those dangerous homemade concoctions with household items. Your body is giving you signals. It's really about learning how to interpret them correctly and reliably.
Absolutely. And what's truly fascinating here, I think, is that while these home pregnancy tests are genuinely incredible tools, they're remarkably accurate, widely accessible, and have empowered millions when used correctly. The very human, very understandable desire for immediate answers or constant reassurance can sometimes lead us down paths that unfortunately create more confusion, more anxiety than they actually solve.
Yeah, that seems to be a running theme.
It really is. Remember, a positive pregnancy test, even if that line is faint, is almost certainly a sign of pregnancy. Your body is doing something truly amazing, initiating this profound biological process. And the most important next step, really, after that initial confirmation at home, is always to connect with your healthcare provider to confirm the pregnancy, discuss your health history, and start planning for appropriate prenatal care. And this raises, I think, an important question for all of us to ponder. In this age of instant information, endless online forums, and immediate gratification, how do we as individuals navigating potentially life-altering events balance our understandable desire for immediate answers and constant updates with the perhaps old-fashioned wisdom of patience, trusting the process, and relying on professional guidance when it comes to something as profound as pregnancy? That initial positive test is truly just the first page of a whole new chapter, not the entire story.
That's a really insightful thought to carry with us. A crucial reminder to trust reliable sources, validated science, and our own instincts, but also the expertise of healthcare professionals. We sincerely hope this deep dive has given you clarity and confidence in understanding and interpreting your pregnancy test results, whatever they may be. If you're still feeling unsure about your results after listening, or if you have any symptoms that concern you, especially those red flags we discussed like persistent pain, unusual bleeding, or extreme nausea, please don't hesitate to reach out to a healthcare professional. A doctor, a midwife, a clinic, they are truly your best resource for accurate information, personalized guidance, and the essential support you need on this remarkable and sometimes complicated journey.